Hi, I'm Dr. Kovesi. I'm a pediatric respirologist or a children's lung specialist here at the Children's Hospital of Eastern Ontario in Ottawa, Canada. I'm also an associate professor of pediatrics at the University of Ottawa. I've been on staff here at CHEO for 17 years, and I'm here to tell you a little bit about asthma. So I often get asked, what exactly is asthma? And the way I think of asthma is, imagine if the building you were in suddenly caught fire, filled up with smoke. Your lungs have a couple of reactions to that right away. So first of all, there's little muscles around the little bronchial tubes in your airways, and those would narrow to try to keep the smoke out of your lungs. At the same time, your lungs would start making more mucus, so that any soot and ash that got into your lungs would get trapped there. And then you would start coughing and wheezing to get all those bad things out. And those are normal reactions that happen in everybody if they're in a smoke-filled room. In people with asthma, they happen because of things that shouldn't be causing those reactions. So typically in people with asthma, they get those reactions because of either viral respiratory infections like colds and influenza, or from exposure to things people are allergic to, like cats or molds or plant pollens. And often in kids with exercise. So what are the symptoms of asthma? Well, there's really three symptoms. The first is cough. The second is chest tightness or difficulty breathing. And the third is wheezing. A lot of people don't really know what wheezing is. So wheezing is sort of a high-pitched, whistly sound coming from the chest. Kind of like a... And a lot of little children have noisy breathing when their nose is congested, which is more of a crackly sound, like a... And that's not a wheeze. They really are different. Now, what are the signs of a significant asthma attack? Well, either a lot of trouble breathing, a true wheeze, severe coughing, especially children are breathing so hard that they're getting tired as a result. And you can often look in kids if the little spaces between the ribs or at the bottom of the neck are getting sucked in. Those are all signs of a severe asthma attack, and of course turning blue anywhere. So parents often worry, how do doctors diagnose asthma? And especially in very young kids, kids less than about a year of age, asthma can be tricky to diagnose. Other respiratory conditions are relatively common in that age group. But perhaps the two most important things for diagnosing asthma is response to therapy. So one of the common asthma drugs, what we call the blue inhaler or the reliever medications, and those should take away asthma symptoms in minutes. So if your child responds to that, that's a good sign. In kids 6 years and older, we can also do breathing tests to help make the diagnosis. So asthma is clearly a serious disease, and it can be life-threatening. But the really good news about asthma is that we've got fantastic, safe medications for treating it. So the vast majority of kids with asthma can be well controlled. And really, I see my job as a lung specialist to control the child's asthma so the asthma doesn't control them. And I've certainly had kids on national sports teams with asthma, and there are lots of hockey players and basketball players with asthma that's been well controlled, so these people can do activities at their potential. So where can you get more information about asthma? First of all, if you live in Ontario, you can get my new asthma book, which is published by the Ontario Lung Association. If you call the Ontario Asthma Action Helpline with the Lung Association, they will send you a free copy of the book. It's also available in a lot of doctors' offices, so it's easy to get. Another option is if you go to the CHEO website, which you can find with any search engine. We have a whole website on asthma, and also the book is available as a PDF file, so you can get it there. And through Canada, there's lots of asthma education centers run through the Lung Association, and again, they provide lots of excellent teaching material as well.